Hello and welcome to Askimo TV. I'm talking today to Dr. Norman Briffa. Dr. Briffa is a consultant cardiac surgeon at the Northern General Hospital in Sheffield and senior lecturer at the University of Sheffield in the UK. Hi, Dr. Briffa, how are you?
I'm very well, thank you.
Great. Dr. Briffa, let's talk about safety of the heart and of your surgeon. So why do you think heart disease is one of the greatest diseases killing men and women today?
That's a very good question. It's probably related to lifestyle. So it's related to the fact that men and women just do not exercise the way they used to. There are so many devices that help us. People don't walk to the shops anymore. They take a car. People don't climb stairs anymore. They take an elevator. People eat too much. So people eat too much of the wrong food and don't exercise enough. And that, unfortunately, is a problem that's spreading in the world. And that has led to the fact that heart disease is one of the commonest killers now.
What would you say are some of your top tips that you can share with people on how to look after their hearts?
Exercise and eat the right food. So to avoid gaining weight, because if you eat a diet that leads to good weight control, it tends to be a healthy diet. So, lots of veg, less meat. If you eat meat, have white meat like chicken, eat fish, limit the amount of fat, certainly limit the amount of sugar you take, and eat healthily, and that should, your heart should be okay.
How does the fat in my food affect my heart?
Well, if you eat saturated fat, which is fat that tends to come from animals, it elevates your cholesterol and bad lipids inside the heart, and that leads to development of atherosclerosis, which is thickening of the linings of the arteries in your body, including the arteries that supply the muscle of the heart, and that can lead to heart disease, angina, heart attacks, that kind of thing.
And is heart disease hereditary? If somebody in my family had it, will that automatically mean that I will get it?
No, not necessarily. There are certain types of heart disease that are hereditary, but it tends to be associated with heart disease that occurs at an early age. So if you had a mother or a father or a brother or a sister that developed heart disease, say when they were very young, in their 30s, that suggests that the heart disease is hereditary. But the bulk of heart disease that affects everybody tends to be related to lifestyle rather than related to genes.
And who's at a higher risk for heart disease? Is it men, women?
Men have so if you look at patients who get admitted with heart attacks, men predominate. Although it is the amount of heart disease is increasing in women, and women are catching up. And one of the reasons, one of the things that causes heart disease is smoking. And smoking is increasing in women, and experts reckon that's the reason why the incidence of heart disease is increasing in women.
And just to finish off, Dr. Briffa, should I have heart problems, how can I be sure that I'm working with a surgeon that is safe?
You tend to get a feeling of what the surgeon's like as a doctor, obviously, when you meet him and you have a chat with him. In the United Kingdom and in many states in the United States, for example, their results are published online, so you can get an idea of what his results are. So, make sure you meet the surgeon before you have your surgery, and try and find out as much about him online.
Thank you, Dr. Briffa. Thank you so much for talking to me today.
You're welcome.